Yes.
Okay.
Yes, you can start now.
Hello, good morning. My name is Robel Rahman. I am a doctor on duty today. Can I have a name, please?
So my name is Ahmed.
Nice to meet you, Ahmed. Ahmed, could you tell me in your one word what brings you here today?
Yeah, actually, I had some problem today. Yeah, I am middle aged and I
Mhm.
have a stressful job, and I am an advertising executive. That's the reason why the stress. This morning, I was giving a presentation to my colleagues. I suddenly felt weak down my right side, especially my arm. Afterwards, a colleague told me that my speech was slurred for about 5 minutes. So he just recommended me to see the doctor. So I'm here. I have never experienced this before, other than slurred speech from drinking too much. Otherwise, I'm healthy.
I'm sorry to hear that, Ahmed. How long have you had this problem?
Maybe rarely I felt this one. I felt a slurred speech when I drank too much. Otherwise, there is no problem. I am not. I'm very healthy. I now feel fine now also. But I have come for checkup. Okay, and I am asking you regarding these things. What to do now?
Thank you so much for sharing information. Could you tell me how long have this episode lasted?
Yeah, this lasted for maybe 5 minutes.
Mhm.
That's what my colleague told me. I don't know.
He told me before you have no say, like problem before. Is it right?
Yeah, you're absolutely fine.
Uh,
Right?
thank you, Ahmed. According to your description and on my observation, I think this problem related to heart or blood vessel. For this reason, we need to carry out some tests. Is it okay for you?
Yeah, of course, doctor.
These tests include a full blood count, thyroid function test, your blood glucose level, and cholesterol level, and kidney function, and other investigation to carry out what is the reason behind for your fallness today. Is it okay for you?
Yes, of course, doctor.
Or we will also refer to use CT scan or ECG and find out the heart condition and brain condition, your brain image of your brain. They find out the any abnormality happen in the brain. Is it okay for you?
Yeah, of course. But the thing is, uh, right? Why do you think are all these tests necessary? Are I'm actually getting really worried by your explanation. Why should I take all these tests?
I understand your condition, Ahmed. Because, get us interest of our health, we need to find out what is the reason of this episode happened. Why is the reason? What is the cause of the behind this behind this your condition? If you not find out right now, if you will be become it will be become more serious problem in you in future. That's why we need to some test to kind of find out the reason.
Okay, right. That's fine. And are you suggesting that I have a mild stroke? If so,
Yeah,
could you have? Could I have a more serious one in the future?
yeah. In your description on my observation, I think related to brain or heart condition. That's why we needed some carry on the test. After the test result, we confirm the your diagnosis. If you have a stroke, we will be make a plan together to how to prevent in future. I give some advice. If you follow my advice regularly, you will be prevent the recurrence of this condition in future.
Okay, I understand that. I understand very clearly. So I'll follow your suggestions, no problem. But the thing is, what can be done to prevent another more serious recurrence?
Yeah, thank you so much for asking. I really appreciate your eagerness. I give you some advice like you change the lifestyle, increase of green leaf vegetable, decrease in intake of junk food, sugary food, and you also do some exercise regular basis that help to increase the blood flow in your body. There's reduce the risk factor like bad cholesterol in your body. Those you will be prevent further serious complication.
Okay, I fine, fine. I'll follow your suggestions definitely. Now, what more to do? Can you tell me?
Is it okay for you?
Yeah, of course, I have to follow, even if it is not okay for me. There is no other excuse, right?
Because we need to prevent your further complication. You need to change your lifestyle, and healthy lifestyle will be prevent further attack.
Yeah, right. So that's very nice, doctor. Thank you very much for your guidance and suggestion.
Do you have any other question regarding any issue?
No, doctor, it is better if you give me any suggestions or guidelines. More important, how should I manage this condition from now onwards?
Yeah, you will be follow regular healthy lifestyle, and you will be reduce the stress, anxiety. You feel free, stress free life. You will be. I know you doing a demanding job. You will be. You will be do some regular exercise, some meditation that help you reduce the anxiety level, and some exercise also reduce the chance of further attack.
Okay, that's quite obvious. Quite obvious. Thank you very much, doctor.
Okay.
Yeah, all right. Yeah, Aisha, if you are interested for a speaking session, you can do afterwards. Now, let me finish Dr. Robel's feedback. Yeah, you can mute now, Dr. Robel. Yes, yeah. So, Dr. Robel, you're doing very fine. Yeah, your confidence level is good, excellent, but you can still improve in the area. You have to do some research. What type of sentences will be better? What type of quality is better? How you can do these things? All these things, you have to focus on these areas. Yes, sorry. So, uh, you have a lot of experience, so definitely you can do well. There is no doubt regarding that, right? So you have to ensure the patient, you have to make him peaceful, comfortable, relaxed. Okay, you have to be sympathetic to him. A little more sentences directed at him so that, okay, you will win him. Okay, you will win him. That means he will be obedient to you like that. So you have to gain his goodwill, we can say, by being very gentle, kind, polite, and friendly. So more friendly you are, the better your speaking session will be. So it will come from the heart. Okay, then fluency is fine. Accuracy, yeah, there are some instances, one or two places you fell, but you can improve, recover, do better sentences next time. So you said, are you understand? Are you understand is not fine. Yeah, in the previous session, you have said, are you understand? It is a do you understand? Okay, do you understand? In the previous session, also, you said lifestyle. Lifestyle. So it's lifestyle. So it's sounding like lavish style. Lavish style. Like that. What is this he's telling? Lavish style or lifestyle? I was thinking. Lavish lifestyle. Lavish style, maybe. So that was little confused with your pronunciation. It's lifestyle, not lifestyle. Okay, short lifestyle, lifestyle, not life, short. Okay, remember that. So pronunciation, be little careful, and you can add a sentence here and there. You're doing very clearly, but in the last I had to ask you two questions more, so that okay you can expand further. But even before I ask, you only should expand and you can try. Okay, there were four questions and I added one or two extra. Okay, you have to expand your length, duration of spoken part. So that's what I suggest you. You're doing fine, otherwise everything is good. All right, gain more confidence, no need panic, gain more confidence. Okay, then I'll give you another card. You can do one more speaking session. You can prepare and get back to me. In the meantime, I'll just get back to Ayesha Chaturani. Okay.